This is the trainer briefing for the CT2 simulation day held at Lancashire Teaching Hospital Trust at the Royal Preston site. The dates are the 30th of August, 14th and 21st of December 2011. First of all, can I thank you all for giving your time freely to help the Deanery develop and set up these simulation days for our trainees. There is a full day of simulation training which is an adjunct to other types of education that our trainees receive. The day is split into two halves for our trainees. Firstly, there is the advanced simulation on common medical emergencies. The second experience is that centered around a virtual ward round. I'll explain both of these later on in more depth. The day is aimed at allowing us to facilitate the trainees to improve their clinical performance overall. At maximum, there will be 32 students in a day, i.e. 16 students per group. And there will be obviously two groups. It is important that the trainees are actively involved in their own learning during these days. They interact with their peers, yourselves and simulated patients. Primarily the simulation station centering around acute medical emergencies will look at hands-on simulation. We've already set up the scenarios and the training that the students are going to undertake. The main issue again is focusing on human factor development in the students, such as clinical leadership, teamwork, communication skills during acute medical emergencies. The virtual ward round will be using simulated patients in a ward setting. The patients will have been admitted through MAU. The students will then be seeing them for the first time post-admission. The patients will already have been clerked. The students will then have the clerking sheets and will be looking at how to interpret the findings that they have in front of them, also with the ability to communicate the outcomes of the investigations and history to the patients, be able to extrapolate the findings from the radiology and blood investigations into sensible, practical management plans and clinical decision making. The virtual ward round, as suggested, will consist of clinical stations with a simulated patient. There will also be two linked practical skill stations. The first is that of central chest drain insertion, which is related to a chest scenario of pleural effusion. The other is a lumbar puncture section station. This practical skill is linked with a headache simulated patient clinical station. There will be one facilitator per station. The practical skills part of the training really is to support the students consolidating skills that they will have learned during CT1 simulation practical skills days, and hopefully will have trained on up till the day that they are seen during the virtual ward round. So it's more of an assessment of clinical competency as much as trying to improve their skills centered around these practical skills. As I've already said, this has to be an interactive scenario centered around virtual ward rounds. The students have to be able to communicate outcomes to the patients, be able to undertake effective management plans on the back of results in investigations. The virtual ward rounds last 15 minutes. However, during these 15 minutes there will be time for the facilitator around 2 minutes to feedback on the students' performance. The skill stations are 30 minutes each for the students. This is the ward round setup. As you will see, as trainers, if these are 15-minute stations, the overall time for the virtual ward round is around about 2 3/4 hours. Therefore, we have put in break times for the trainers, which are numbered B1 and B2. So there will be roughly 30 minutes for the trainers to have natural breaks and coffee and teas. The advanced simulation station we have already built up, and I've discussed with the trainers about the clinical scenarios. We will be looking at 3 to 4 clinical scenarios which the trainees will be involved in. They will have audio visual feedback on their performance, and again there will be a concentration on focusing on human factor performance of the trainees. We will ask the trainees during our briefing of them to be interactive. Their peers, the trainers, and the simulated patients during the simulation stations, both on the virtual ward round and the emergency presentations. I would ask for you to be supportive, analytic, critical, and objective in feeding back to the trainees. The feedback for the trainees includes simulated-based assessment forms, certificate of attendance, which can be added to their e-portfolio. We hope that they will be able to give us constructive feedback so we can improve our training day, and the facilitators will also be given a deanery-based certification for supporting these training days. We are asking our trainees to be punctual, to stick to their groups, to be interactive, and as I've said, to give feedback throughout the day. And finally, on the day for the trainers, can I ask you to turn up at around 8 o'clock to make sure you meet with your simulated patients and ensure you are happy with how the station will run. Please ensure you have everything you need to support the smooth running of your station. Help will be at hand to support you throughout the day. Parking is provided for all trainers who are coming from other sites, and we will provide feedback to you on the day in question. Can I once again thank all of you for your support for our 3 simulation days. If there are any issues on the day or prior to that, the phone number is on this slide. Please give us a ring, and we'll try and address it. Otherwise, I look forward to seeing you on these individual days.